children suffering with influenza, children suffering with RSV, and lot of bacterial infections as well we are seeing. Lot of children develop pneumonia. That is on the rise. When I say rush to a pediatrician, it's always better to go to a place where all the facilities are available. When I am looking at the child, I always look at a child. I never see them as a patient. Their child is priority, and for that child their family is priority. Right treatment at right time in the right place is the key.
Welcome to the program, Dr. Suresh, and it's so good to have you here.
Hi, good morning.
So, Dr. Suresh, it's that time of the year where the city is grappling with a sharp rise in acute respiratory infections, we can say. A lot of children of different age group. So what exactly is the ground reality and how busy is your OPD?
Of late, we have seen a significant rise in a number of children suffering from respiratory tract infections. As with every year, during this season, once the monsoon sets in and then monsoon is about to get over and then the winter begins, we see a lot of children suffering with respiratory tract infections. This year, similarly, we have a significant rise and we are seeing a mixed kind of infections. When I say mixed kind of infections, respiratory, viral as well as bacterial infections. We are seeing a lot of new viruses. They are technically not new viruses, but the rise in the number of cases with those viruses are increasing. So we see children suffering with influenza, children suffering with RSV, and lot of bacterial infections as well we are seeing. Something which we were all surprised is increase in number of cases of viral exanthematous illnesses, something like measles. And post this illness, lot of children develop pneumonia. That is on the rise.
So this morning, just before coming to the shoot, I had a couple of my friends calling me and asking, looks like my child is infected with respiratory syncytial virus or RSV. I was like, what are you talking about? So when we hear these technical terms, like, we have a lot of public talking about RSV or influenza virus. So how different are these viruses and why do we get to hear these terms?
These are all pretty old viruses. Only thing now, because of the advances in investigations or diagnostic modalities, thanks to COVID, now everybody knows what is PCR, everybody knows what is viral panel, everybody knows what is upper respiratory viral panel or throat swab or nasopharyngeal swab. Because of this, now we are able to diagnose more easily. Is it that we didn't have this investigation before? No, we had this investigation, just that the awareness amongst the general public has increased and acceptance by the general public has increased because they have seen when we diagnosed a deadly illness like COVID using a simple nasopharyngeal swab. And more labs have started using this technology. Now this throat swab or nasopharyngeal swab is easily available and much lesser expensive as compared to what it was 5 to 10 years ago. So because of these modalities or improvement in these diagnostic modalities, we are able to diagnose this. Like you said, yes, there is a rise in RSV, there is a rise in influenza because we are diagnosing more. And more importantly, we are seeing a lot of complications related to influenza and RSV. Like just about 4 weeks ago, we had this 2.36 kilo baby whom we had retrieved from outside. The baby was born with a birth weight of 650 grams and was hospitalized for about 8 weeks and then went home and again came back with this illness. Picture presenting as bronchiolitis, that is a simple respiratory tract infection. When we diagnosed, this child had RSV, that is respiratory syncytial virus. This is one of those viruses which has been there in the past, but now it has come out with resurgence. So this kid had to be ventilated in the highest form, that is what we call high frequency oscillatory ventilation, was on the verge of ECMO. But with this good technology in management and all, this kid has come out. Similarly, lot of children with influenza do go home from the outpatient department itself, but some of them, they tend to develop complications like respiratory failure, requiring invasive form of ventilation, ICU admission, oxygen administration. All these things are increasing.
So as you said, that awareness and acceptance has increased among the parents. So getting the right treatment at the right time and not delaying, just thinking that it's a common cold or cough is important.
You're absolutely right, because unless parents recognize that there could be something which is serious, there will be a delay. So do not delay thinking it is like common cold, because you rightly pointed that right treatment at right time in the right place is the key.
Yeah. But as parents, we all tend to get alarmed when our kids fall sick, irrespective of what kind of sickness it is. So when do you think that, we should consult a pediatrician, especially for these symptoms? Or do you think we can just stay at home and take the first aid medications and give them over-the-counter medications for a while?
Common viruses like rhinovirus, which causes common cold, it causes running nose, nasal discharge, probably some sneezing. But if the child has high grade fever, difficulty in breathing, difficulty in feeding, and difficulty in sleeping, so any of these three things are affected, you should rush to a pediatrician. And when I say rush to a pediatrician, it's always better to go to a place where all the facilities are available, rather than being in a simpler place thinking everything would be fine. It's better to be safe rather than feeling sorry later on. So anybody who has high grade fever disproportionate to the symptoms, rest of the symptoms, or severe body ache that child is not able to do their routine activity, or their feeding has decreased so much that the urine output has gone down. So if they are not able to sleep comfortably, that's the time they should rush to a pediatrician.
So I always had this doubt in my mind, you as a pediatrician and also as a parent. So how do you balance this, or how do you fight the conflict within? I mean, what's the mantra?
So like when I speak to the parents who come to me, I always say I am a father first, and then I am a pediatrician. So when I am looking at the child, I always look at a child. I never see them as a patient. That is first rule, what I have said to myself, thanks to my professor who actually guided me in the right direction. That's one. And two, when we are advising them, it's always good for a senior pediatrician who himself or herself is a parent, because they would have at the back of the mind about the empathy which is related to the family. When we are treating a child, it is not just the child, but we are looking at the whole family. That is what we look at. And then we take a call and advise accordingly.
So discussing about the latest treatment managements which are available today, are there any recent or newer advancements that we have seen?
Lot of changes have occurred. This is my third decade in practice now. I have seen an era where ventilation was considered the terminal thing. So when we started our career, anybody who goes on ventilator were expected to be going through their terminal illness. Now things have changed. We ventilate them pretty early, and again thanks to COVID, lot of non-invasive ventilation has come into picture. Like the newer advances include HHFNC, what we call heated high flow humidified oxygen. We deliver oxygen in a heated and humidified oxygen in a lighter form to the child in a non-threatening manner. This is one big new advance, and lot of newer forms of ventilation have come, that is safe ventilation without causing any harm to the child's lungs. We are ventilating. And ECMO, previously ECMO was considered an alien thing in our country, but now in our institute itself we put a child or an adult on ECMO probably every fortnight. So, and the outcomes of ECMO are also increasing. Now we have got vaccines which especially for influenza, every 6 months a new strain is released. This is something which parents have to realize, because they think, yes, I have given a vaccine to my child, everything is fine, but they need to consult their pediatrician because newer strains have come up, because every now and then new strains of influenza also come into picture. So the vaccines have to be updated. And for RS, we have got this monoclonal antibody, which after much anticipated time, it has just recently been launched, and we at Yashoda are even using that, because these tiny preterm babies, when we are talking about these tiny babies in this week of prematurity, World Prematurity Day, so now these preemies, we put in lot of hard work to bring them out. sleepless nights of nurses, young doctors, consultants, neonatologists. When we put in lot of efforts, we don't want them to be readmitted with a simple RSV virus. So now we are even using monoclonal antibody for RSV prevention. These are all lot of new advances.
So I'm sure as a pediatrician dealing with, newborn babies and also young children, I'm sure it's stressful because it's not just the patient, but you're also dealing with the entire family who are equally stressed up. So how do you manage this, or how do you unwind by the end of the day?
It is definitely not easy being a pediatrician, especially in the ICU, because like I said, we deal with the family, not just the child. So there are a lot of emotions attached to this, especially as tiny baby who is admitted, and there is not even a bond developed between mother and the baby, but yet there is definitely an inherent bond because baby was in the womb for 6 to 9 months. So we have to deal pretty carefully, and at the same time we should not be carrying this stress back home, because at home for any parent their child is priority, and for that child their family is priority. At the same time, we cannot leave somebody who is admitted to the unit because they have come with plenty of hope. So what we actually do in our unit is we have a team of consultants, and every day there is a consultant who stays in the unit. So that takes out a lot of stress to the other people because we know that the baby is safe. My answer to your question is, as a team we are able to do that. As an individual we will never be able to do that. So teamwork definitely adds up.
Yeah, I think that's well said. So discussing about preventive measures, doctor, I'm sure any disease could be prevented, or any infectious disease can be prevented. So as parents, I'm sure that, there are a lot of preventive tips that we can inculcate these habits to our children. But how do you think that it's easy to train the children as such, because they're exposed to different environments, be it at home or at school, and it's not within our control to always protect the child? So how do you think we can follow these measures?
Well, that's actually interesting, because now here you are bringing up one preventive aspect to how we can inculcate these things in a child who is not completely under your control, because circumstances do change from home to the school. So first, we ourselves should be convinced that the preventive measures work, and then we will be able to convince parents. As a parent, if you are convinced that some of these preventive measures have actually shown benefit, for example, with vaccination, a simple vaccination related to influenza, we can avoid 80% of hospitalizations. That itself is significant. A parent who has actually seen that by themselves, they would believe in it. And similarly, again, I would thank COVID in multiple ways, because that has taught us basics of personal hygiene, which was long awaited, which is a simple step which prevents infections. Personal hygiene and personal protective measures like wearing masks and cough etiquette. If somebody has cough, never cough into their palms, because inadvertently, without knowing, you might just handshake with someone else and then you're transferring all the bugs to them. So it's always better to cough into their elbow, because that's where you will not shake hands with or come in contact with that. And try and avoid gatherings when you are unwell. Frequent hand washing and healthy food plays a very important role. When I say healthy, cooked food at home, including 2 fruits per day and 5 veggies per day, is something which is healthy, gives you enough vitamins, minerals to fight, and less dependency on medications to improve the immunity.
And likewise also, I think even the schools have to follow certain preventive measures, like advising the child to stay away from school, and also placing a safer distance while they are sitting in the classroom, and also maintaining the AC room temperature. You think even that would be helpful?
Absolutely. Like we say, mother is the first teacher, but once they go to school, for them teacher is the primary one. Whatever we as a parent say, it might not be Veda, but when the teacher says, that's it. But again, schools have a major role in helping children stay safe, and thereby improving the health in community as well.
So thank you, Dr. Suresh. It was wonderful having you here on our program today. So before we wrap this episode, is there any message that you would like to share with our viewers out there?
Healthy food, include 2 fruits and 5 veggies per day. Drink plenty of water, keep yourself hydrated irrespective of the season, and stay fit with good amount of physical activity, spend less time on the screen and more time in the ground, and vaccinate yourself and seek advice at the right time, at right place with the right person.
So this brings us to the end of this episode. Hope this episode was informative on the topic respiratory infections in children, and more importantly, how to prevent them. And don't forget to join us for next week as well. Until then, take care and stay healthy. Thank you.